discuss. But I think just as a concern, did the cabinet, discuss the issues with regards to the xenophobia attacks, since Zimbabwe is directly affected? Thank you.
Okay, it will be noted, although, as you rightly say, it was not discussed because there are certain specific fora where such issues are discussed. In other words, committees, special committees will come in. Yes, please.
Thank you. My name is Leo from newsblog.com. My question is in relation to our discussions with HCB and ESCO. And then in the same context, ESCO. Have we been paying to ESCO and how many installments have we paid, so how much have we paid? Thank you.
Okay, last one. Somebody else right there.
Costa.
That's behind you.
Thank you, Tapi Chamber from Zimbabwe TV. I just need clarity from the Minister of Health on the health services bill. I noticed something as the Minister of Information was given an outline, that there is to be a collective approach to this whole striking position. Just give us clarity what you mean, or what this new bill is going to be saying regards strikes in the future. Thank you.
Okay, that completes the first cycle. I hand over to Honorable Chair.
Good. Good.
Thank you very much. Thank you very much. Again, our Minister of Finance, who should have been with us this afternoon, has already traveled to South Africa. But the aid coordination policy is actually tracking information with the development partners. It is critical for every government to make sure that all development partners which come into the country, they work hand in glove with the government institutions. And as such, there is absolutely nothing where it says government will sit back and not support some of those programs. We have been working with, and Zimbabwe is not the only country which works with development partners. And we are very grateful that they are in our country, and as long as they are working together with us. The policy actually wants to improve on the coordination. That's what is critical. So that if development partners, for example, are working in a particular region, we can't have 3, 4 working in one province, and then the other province, there's nothing happening there. So it's critical that they work, there's coordination, so that we spread the help around the whole 10 provinces of our country. That's what this aid coordination policy is aimed to address. On Columbus Mavunga's question, the doctor strikes, how serious are we in dealing with this, Honorable Minister of Health?
Yes, I want to thank you very much for that question. I think it's a very useful question and very precise at the moment. We are extremely serious as a government to ensure that all our workers work in line with the laid down conditions of service, monetary and otherwise. And with regards to our doctors, yes, there was some notification, but unfortunately, after their notification, they then went to a meeting with our Health Services Board, and in that meeting, everybody agreed to some points, which are related to, which ended up, with a collective bargaining agreement. So that collective bargaining agreement is what had to be adhered to as far as the Health Services Board was concerned. But to the surprise of everyone, there was a change of status by the doctors, and the Health Services Board, in that agreement, it had already been agreed that they would look at the health-specific allowances, look at transport allowances, housing allowances, provision of buses, for health workers, and as was stated for everyone, there would be a review of the COLA allowance, in the fourth quarter. So everything is stated there very clearly. But I'm very pleased to note that out of the junior groups, the most senior amongst the junior group, who are the senior resident medical officers, they've all come to work. Not even one of them is absent at all our central hospitals, but it is the junior resident medical officers who find it necessary to indicate that they are incapacitated, and we hope that they will take heed and come back to work. That's what we want to see happening, because government is looking at the requests. We're not just going to sit and say, whatever we agreed should be looked upon is not going to be looked upon. Everything that has been agreed upon will be looked upon. And I actually had a meeting with the Minister of Finance, and we agree that as soon as we will be looking into all these issues, which need the immediate attention as per the collective bargaining agreement. We go by the collective bargaining agreement, where all these issues were stated. So really, that's the situation.
Okay.
Thank you.
Thank you very much, Minister Moyo. And Pauline, Daily News, I think, as already Chief Secretary has indicated, it's an issue which is dealt with in with other certain committees of cabinet. Government is seized with what is happening in South Africa, and a statement will be issued later on. Thank you. On leonewszimbabwe.com, the HCB and ZEXCO, which you mentioned, and the question was, are we paying our installments? And yes, I would say yes. I would not have the list of payments which have been done, but certainly yes, the installments are being paid as agreed. The Ntakucha Ambakwe, he wanted clarity. He wanted clarity on what this new bill is saying about having strikes. I guess you have dealt with it, but you can expand.
Okay. New bill. Yes. The principles of the Health Services Amendment Bill seek to achieve a situation where in future everybody will be fully aware and it will be enacted that healthcare services are an essential service for real. At the moment, we seem to be working on a willy-nilly basis, and we want to make sure that all our workers appreciate that it's actually an act, that it's going to be, that it is an essential service. When you are a health worker, you are providing an essential service. And the issue that, the fact that is going to be a commission will further strengthen the fact that, the health workers are also in a position to respect their own profession. Government is respecting the profession of healthcare workers. And that is why we are also coming up with the commission. There will be the opportunity for healthcare personnel to look after or to be composed in that healthcare commission. So this is a very good move. It's a plus for the healthcare service, and it will align all the ideas and the expectations of the healthcare workers. But on top of it, it will also ensure that there is timeous delivery of requests by the healthcare workers, from the healthcare workers to the commission with immediate answers. Because there will be more access, and we'll be able to get rid of that panacea effect which has been taking place on a continuous basis. So I think this is something which is worthwhile. And this was as a result of a request from the healthcare workers themselves. Since 1992, there was a commission which was formed which had to look at the healthcare services. And there was a recommendation that we have a health services commission. And before that, I'm told that in the early 1920s, there was also that request. So finally, government has seen it fit, that commission must be put in place for the benefit of the operations of healthcare delivery in Zimbabwe. Thank you.
Chief Secretary, that brings us to the end of the first round. Maybe we need
Thank you
to
very
just...
much. Right, let's have the last round. Yes, please.
To the Minister of Health, I think
You didn't say who you are. Now you know everybody knows you. Maybe he doesn't know you.
I'm Leo from newsletter.com. So I think the question is, will those in the health sector be allowed to strike after all? And if they are not allowed to strike, what if they strike? Thank you.
Okay. Question now? Make yourself visible. Yes, behind that, say repeat. Okay.
You mentioned irrigation scheme with Marker Resources, if I got that name right. Currently, Parliament is seized with issues to do with Command Agriculture, where there's been a lot of talk of misuse of state funds, taxpayers' money. Did Marker Resources go to tender before they got this deal? And which areas are they starting to develop these irrigation schemes in partnership with government?
Okay. Yes, I did back then.
From USDN. Briefing from the Otis General Report. Marker Resources was noted not to have supplied goods that they had been paid for under agriculture. And the Otis General indicated that public funds could have gone missing through that process. And we hear now that government has started markers again. What mechanisms we have as government to ensure that these public resources are not abused again going forward? This is a report of the AG.
Okay. And the last one. Let's see anybody there.
No.
If we don't, that's a political circulation. We might as well end with those three.
The national investment policy, just to remind them.
Back to you, Chair.
Thank you. Thank you very much. Once again, Leo, and his question is, will those in the health sector be allowed to strike? And if they are not allowed to strike, if they strike, what will happen? Minister of Health.
Yes, thank you very much for that question. We are in a democratic country where people are allowed to voice their concerns, but if you are part of an essential service, you are expected also to show your respect, especially in the case of healthcare personnel. You should show respect for those you are looking after. We are dealing with lives, and therefore you should also show that you've gone through a thorough training, and part of that training would have shown you that at the end of the day you are gaining knowledge to be able to save lives. It becomes really unprofessional to leave your patients, to leave them to die. That is what we have to go against. Do not leave your patients unattended. We have to act responsibly as healthcare professionals. We have to make sure that the bill will make sure that while collective bargaining action, job action, cannot be an indefinite exercise, and as it will endanger the patient's lives. So there will be a defined period of time where people can voice their concerns, but not indefinitely. Maybe a matter of hours, carrying a placard and making sure that your statement is late. But not to go forever and allow patients to die. You see, that is the bottom line. And, we really have to make sure that while we should be allowing people to express themselves, they should express themselves in the correct manner, in a responsible manner, realizing that at the end of the day, you are looking after patients. We should not be in a position to allow our patients to die. Patients don't come to institutions to die. Yes, we appreciate that our healthcare workforce also needs to survive, but everybody else also needs to survive. And so we should be working within a framework where we can be able to say, yes, we've had it, yes, we're going to do something about it, and that is exactly what we are doing now. We're doing something about the requirements as a government for everyone. And for the healthcare workers specifically, we are looking at the particular issues I mentioned here.
Thank you very much, Minister Moyo. Takuchamba kwe and Kolisani were concerned about, which is very good when citizens start questioning which companies are being given government contracts. But I must say the importance of rehabilitation of our irrigation cannot be of the change which we are faced with. We've just gone through a very serious drought where we now have to import our maize from, which is actually getting the foreign currency which we need so much. So the issue which is here is quick rehabilitation and development of our infrastructure in irrigation throughout the country. And what the ministry is doing, they are obviously considering companies which have got the capacity to jointly work together with them to make sure that these 100 hectares of irrigation within the next 3 years is achievable. And the question of Maka having been a company, I think that's something which I need to verify with the minister since he's not here. But the question that they didn't supply what they were asked to supply during the Command Agriculture, we do not have that information here. But yes, Parliament will continue to do their job of oversight to make sure that companies which are engaged by government to do such an important, a very important project, because everybody is looking at agriculture. Otherwise, we can't continue to do agriculture looking into the skies. We need infrastructure of irrigation in place, and we do have the water, we have the dams, so it's important that those 100 hectares are there in the next 3 years to mitigate the drought situation. That's how I can answer for you, both of you, Taku and Kolisani. Thank you. And if I can give the Minister of Industry and Commerce. Yeah.
I'm trying to avoid going without saying
Yeah, okay, sure.
Just to address on the point of Maka resources. Firstly, it's an unsolicited offer. So they made an offer to government, a value proposition was made, which proposition will be evaluated. Maka is pretty much the only company in Southern Africa, outside South Africa, that is manufacturing center pivots. Others are importing center pivots to supply. And they want to benefit our agriculture by providing a facility where they go to rehabilitate or put up an irrigation system. And from that system, they will recover their investment. So we are also not talking about government putting money there. They will go to an irrigation scheme, put up the infrastructure, And in most cases, they will be supporting them with the inputs. And they say it might take up to 3 seasons to recover their investments. And we are targeting 200 hectares per district minimum. The 100,000 target is over 3 years. So we looked at it, firstly, it's addressing our food security situation, but also it will create a platform for our manufacturing sector to grow, because we have this company which can even, in the short term, begin to export these center pivots to the region. So I want to allay fears to colleagues here that this is, in my view, a very good deal for our country, for both industry and agriculture. Thank you so much.
Thank you very much, Minister Ndlovu. And that brings us to the end of this briefing.
Thank you very much, Chair. At this point, let me also thank our members of media for coming and posing quite useful questions. I hope you are equally happy in the educated others. So until we meet next time, there is no more time for questions. Next time.
Thank you.
Okay.
Thank you, guys.
Okay. Thank you. Thank you, Chairman.
Thank you.